Hello, my name is Lanessa Brown Santiago. Today I will be talking about mental health crisis response teams as a new form of policing in the United States. Today we'll be talking about mental health crisis response teams as is what they are, why they are growing rapidly, and how they aim to reduce harm while improving outcomes for both civilians and officers. Firstly, we'll be talking about why this matters. Mental health related 911 calls are increasing nationwide. In fact, 20% of police calls, about 1 in 5, involve a mental health crisis. Traditional police training does not focus on clinical crisis care. Oftentimes, officers feel they are unprepared with their training to handle crisis intervention. And because of their lack of training, these encounters can escalate quickly, sometimes leading to harm, unnecessary arrests, or even fatalities of the officer or the civilian involved. The next thing we are going to talk about is the challenge for police officers in integrating the crisis intervention response teams as well as their current handle of crisis intervention responses. Oftentimes, officers feel unprepared to handle mental health emergencies as they are not trained properly in crisis counseling or in mental health crises, as well as they are not trained enough in de escalation skills. Typically, police training focuses more on firearms and enforcement than it does in crisis counseling. Calls are often unpredictable and required specialized knowledge, which again, police officers feel or know they do not have, as they are more properly trained in firearms and enforcement. Police are also routinely placed in the role of mental health responders when they are dispatched to these types of calls, which we know they are not trained to do. They are not mental health counselors, they are not crisis intervention specialists, they don't require the proper training or knowledge to handle a individual or individuals having a mental health crisis. We can look at this diagram at the top here, which is data taken from a emergency dispatch survey in Michigan asking if CIT, meaning crisis intervention trained officers, specifically called out to mental health crisis calls. 14% of these cases said yes. Within that 14% of the officers that are dispatched to these types of calls, 46% of those officers probably or definitely do not have enough training in crisis intervention. 31% may or may not have enough training in crisis intervention, and 23% of the slim 14% of officers dispatched to these mental health crisis calls do have enough training in crisis intervention and are better equipped to handle these situations. Next thing we will be talking about is what crisis response teams actually are. The definition is that they are specialized teams that respond to mental health related 911 calls with a specific set of goals. Their goals are actually pretty simple, and it is to de escalate, stabilize, and connect individuals to mental health services instead of jail. That is the big goal of crisis response teams, is to avoid unnecessary arrests for people suffering from mental health crises, as jail or prison typically won't help the person get better. Their teams may include a couple of different types of professionals, including mental health clinicians, social workers, paramedics, peer support specialists, specially trained officers. Here we see an illustration providing tips and points for officers when they need to de-escalate a situation safely if they are not with or accompanied by a mental health specialist. Oftentimes as well, these mental health specialists can be brought in a bunch of different models. These models that I was talking about would be the models of crisis response, typically broken down into 3 parts. First being co-response teams, which would be a police officer accompanied by a mental health specialist. Well, in more specifics, a mental health specialist accompanied by a police officer, as the mental health specialist will be the one initiating contact with the individual, assuming they are showing no signs of aggression, violence, or if they are not dangerous. The next thing would be a mobile crisis team, which would be a mental health specialist responding without the accompaniment of police officers. This is typically when the call involves no criminal activity and just simply somebody having a mental health crisis. Say somebody is attempting to harm themselves or commit suicide by jumping off of a building, a bridge, whatever the case may be, but they're showing no signs of danger in the moment. The next would be a hybrid model. This is where the dispatcher who receives the call decides what team is best appropriate based on the nature of the call. Again, this would be based off of whether the call is a crisis call that shows signs of aggression or danger. That would probably be more suited to have a police officer accompany the mental health specialist, or again, if the individual is not showing any signs of aggression, it doesn't seem like a super dangerous situation, to put a mental health specialist in, where the mental health specialist would go alone. Next, we have the relational model of crisis management. As you can see here, it's broken down into 4 main groups, starting with post-crisis management in the upper left quadrant, crisis incident management in the lower left quadrant, crisis preparedness in the upper left right quadrant, and crisis prevention in the lower right quadrant. Now, we've talked a lot about what a